We're also being joined now by Dr. Rajiv Gupta. He's a member of the National AEFI Committee. Also joining us is Dr. Sanjiv, chairperson Nephron. I'm going to first go to Rajiv Gupta. So we are seeing a massive uptick in the number of COVID cases. This is a nationwide increase. The numbers touching up to 1,000 almost every day. This is the time, when all the horrific memories of the coronavirus days were in the back burner. Caution had been thrown to the wind. What advice would you like to give our viewers today, considering this sort of a daily uptick in the number of cases which we are seeing? Rajiv Gupta, I believe you're on mute by mistake. Okay, we'll go back to Rajiv Gupta. Dr. Gawai, would you like to take this question, sir? Any advice you'd like to give the people? Because end of the day, caution is the need of the hour. The government also emphasizing on how there is a need, of course, once again to test, to maintain social distancing, and once again to wear our masks again.
Good morning. So just very quickly and briefly, I think we should focus on prevention, focus on awareness, and not equate awareness to panic. Yes. So there is no need to panic. We know that the recent surge, I will not call this a wave at all, the recent surge in the increase in cases have been because of XBB 1.5, which was nicknamed as Kraken variant, and now XBB 1.16, which is called as Arrakis as a nickname. Now, especially these two have specific mutations, especially the XBB 1.16 in the ORF9B platform, which makes it slightly more invasive than the previous Omicrons. I think we need to do the simple things in a simple manner. Avoid crowded places. Please wear a mask which is of a specific grade, which is N95, and avoid very large get-togethers, poorly ventilated rooms. For people who have not got the third dose, which is the booster dose, please get a booster dose done. I would like and request the government to have the intranasal vaccine widely available, because that will give a very, very good lung protection as far as the resident memory T cells are concerned, which the Bharat Biotech has already made, and advise everyone to get the third booster dose. Yes. There is no need to panic, especially the vulnerables and the comorbids need to be specifically careful not to expose themselves. Even a mild infection can have lingering damage of more than 20 organs, up to 8 months of immune dysfunction.
And that's a very important point which you emphasize on, sir. The need to get a third booster dose. Stay with us, sir. We also have a ground report which has been filed by one of my colleagues. Let's take a look at that. And then, of course, I'll come back to both of you.
As the country is witnessing a surge in the COVID-19 cases, there's an uptick in the fresh cases across the country, while as 4 more deaths have been recorded across the country. The leading pulmonologist of the Kashmir has to say that the situation is totally under control in the Kashmir. However, advised people to take utmost precautions in order to prevent any sort of surge in the COVID cases in the future. He also said that the situation is totally under control and the people are well behaving with the COVID. With video journalist Shafiq in Srinagar, Yavar Shafiq for Times Now.
Rajiv Gupta, a member of the National AEFI Committee, also with us. Rajiv, if you can hear us now, earlier also I was asking you, what is it that the people need to do now? Masking up, of course, the need of the hour. At the same time, something which Dr. Gawai was also emphasizing on, all of us need to get our third booster shots, if, of course, anyone is still remaining to do so.
Yes, thank you. Yes, Dr. Gawai is absolutely right. This new variant, this XBB 1.16, this is related to the XBB 1.5, which has been declared a variant of interest by WHO and is expected to now emerge as certainly one of the dominant strains across UK, yes, Europe and USA. So it is related to that, and probably what we are witnessing is a global surge or rise. But at the same time,
so we are witnessing a global surge. We need to be cautious. That's the advice coming from your side, sir. We also have a caller, Pradeep, who's calling us from Bangalore. Yes, Pradeep, go ahead. Is there anything you want to say? Because we are seeing a massive uptick in the number of COVID cases. If you look at the breakdown of state-wise data, cases are rising in the state of Karnataka as well.
Yeah, good morning all. So We have seen that the COVID vaccines were very effective 2 years back, and after that there have been many variants which have emerged. So are the COVID vaccine manufacturing companies planning to produce an upgraded dose of vaccine, and if so, when will that be coming to the market?
Okay, that's
my question.
Okay,
Thank
and Dr. Bagai, if you could come in here, because that's a question which has also come from the side of many callers and many other concerned citizens. People are worried. They are worried about the efficaciousness of the vaccines which they have got, because earlier, I'm sure you remember, reports were coming in that every year or 2 years we need to repeat those doses. Anyone who has managed to get 3 doses, 2 basic doses and a booster dose, are they perhaps better protected against the disease, sir? What would you want to say to allay such fears?
3 important parts to this, to put it in a scientific manner. The vaccines which have been made worldwide initially and are still being used all over the world are against the original strain. We know that the strains have gone from alpha, beta, delta, gamma, eta, and then Omicron. And Omicron itself has more than 1,000 plus sublineages to date. So obviously the vaccine cannot keep pace with the changing mutations. Having said that, the present vaccines which are available in India, AstraZeneca and the Bharat Biotech, both will give a reasonable protection, around 50 to 60% to prevent infection, but more than 90% still to prevent serious illness, death and hospitalization. The second important point is that the intranasal vaccine gives a very good protection at the site of entry. And it gives a very good, strong T-cell, memory resident T-cell protection in the lung. And I will very strongly request the government to make that widely and immediately available to every healthcare center. The third important point is we should look at our own developed bivalent vaccine. The bivalent vaccine is giving a much better cover as compared to the monovalent vaccine. When we say it's a bivalent vaccine, it's a combination of the original strain and BA.2 or BA.45. So we should have our own bivalent vaccine and en route towards a universal COVID vaccine.
All right.
But having said that, your third dose is still important. It will prevent you from serious infection and death.
Yeah, but just to take this forward, sir, and Rajiv Dasgupta, if you could come in here, because already a debate is raging. Many are asking this question already. Do we need a 4th and a 5th and a 6th dose? Should it become an annual phenomenon like the other vaccination which we get, the vaccines against COVID?
No, the National Technical Advisory Group, based on the current evidence till now, as we speak, has not decided in favor of any further doses. However, completing the basic 2-dose schedule plus a booster is certainly very strongly advisable and needed. At the same time, this XBB 1.5 has immense immune escape properties. So as per available evidence from the UK and Europe, remember it's spread across nearly 40 countries, and this 1.16 is related to that. Even with 3 or 4 doses of mRNA vaccine plus a natural infection with BA.5 is still not protective against this. In other words, these strains have immense immune escape properties, but at the same time, there is still no evidence, or at least not till date, that this is of increased severity. This is
fair enough. So for now, the 3 doses, absolutely, I've taken your points up. For now, the 3 doses, that's your 2 basic doses of vaccines, and also, the booster dose on top, that's enough to protect us against coronavirus. At the same time, we need not let our guard down. Masking up, social distancing, all those things need to come back into our memory. For now, thank you, both of you, for joining us, taking our time to speak to Times Now.